So we're here today to talk about fixing it in a way that makes it accessible for all Washingtonians. Because we live in a society that prides itself on being a global leader, and we are indeed one of the wealthiest nations on earth. And yet when it comes to healthcare, we are failing our people. And according to recent studies, the United States spends more on healthcare than any other country in the world, nearly twice as much per capita as other developed nations. But we're not seeing the returns that the other nations are. We have higher rates of chronic illness, higher maternal mortality rates, and higher infant mortality rates than many of our global counterparts. And in fact, a study published by The Lancet found that life expectancy in the US is lower than in countries like Canada, Germany, and even Chile. So this is not just a number on a page. These are lives lost, families torn apart, and a national healthcare system in decline. And what's the root of this problem? I think personally that we put profits before people. And I have not been a fan of a for-profit healthcare system ever since my daughter was born, extremely premature, weighing 1 pound, 13 ounces, and spending 5 months in an incubator. I was very fortunate from the standpoint that at my law firm, they said, we got your back, we cover your cases, we're gonna pay you, go be by your daughter's side. I didn't have the extra stress of losing income during that incredibly traumatic time. And looking at her in the incubator, hooked up to all this machinery, including a tooth down her throat that looked like it weighed more than she did, you knew this was not something you were gonna kiss and make better. And I'm gonna tell you something, my worst fear was not just that she would die. There was that was very apparent that could happen. It was that she would die and I wouldn't be by her side. That was my worst fear. And so when I got pulled away, because the docs told me that the healthcare plan said they weren't going to pay for her care because it was quote unquote experimental. Let's just say I didn't receive that well. And I am a trial attorney, and by that time I had already represented insurance on behalf of insurance companies, and I'd already sued some insurance companies. So I knew how to short circuit that appeals process of the denial of the claim, right? And I did, and they paid for my daughter. But when I went back to the NICU and looked at the other families living through the same trauma, through the same feeling similarly vulnerable and afraid and isolated in a lot of ways, and knowing you're helpless to help your own child, I had to think they were doing the same thing to them, and they were doing it for the sake of profit. And so for me, I'm not a fan of a for-profit healthcare system, and with 20% of our healthcare system that goes to profit right now in a multi-trillion-dollar industry, that's a lot of money that could be going toward healthcare, right? So trust me when I say that, insurance companies, pharmaceutical giants, and healthcare corporations make billions, while millions of Americans go without basic care. And where medical bills bankrupt families, where life-saving treatments are out of reach for those who need them most, we have a system where people are forced to choose between putting food on the table or paying for their prescriptions. And that's the reality that a lot of our fellow Americans live with every day. And I find that immoral. So it doesn't have to be this way. And I know this isn't going to be easy. I know it isn't going to happen overnight, but if you don't have people in positions to help make this happen, we're never going to move toward a system that is fair for all Americans. And we have the resources, we have the technology, we have the know-how to build a healthcare system that does work for everyone. Universal healthcare is not a distant dream. It's a practical, achievable solution that has already been successfully implemented in countries across the world. And in countries with universal healthcare that cover all of their citizens, it's seen as a human right, not a commodity to be bought and sold on an open market. And it's time that we take that same approach here. I have said often that this isn't just an economic or a policy issue, it's a moral imperative. fact, I called our healthcare system morally bankrupt. And it is a human right. And I say that, as I said, with the conviction of a parent who had an instance where her infant daughter was initially denied care. So every person, regardless of their income or social status, deserves access to affordable quality health care. And we can't in good conscience continue along this path. And that's why organizations like yours that has dedicated themselves to making sure we move in that direction are so critically important, and critically important right now. Your lobbying effort down in Olympia has made an enormous difference. It's why we have the Universal Healthcare Commission. And by the way, I not only voted for that, we intentionally put the insurance commissioner on that commission. And I intend to be more. And we know what the opponents will say. The opponents of universal health care will argue that it's too expensive and that it'll lead to inefficiencies, that it'll burden taxpayers. But it's clear that a single payer system actually reduces costs, actually increases efficiencies. And the financial burden of our current system, billions spent on administrative waste, insurance overhead, and preventable illnesses, far outweighs the cost of transitioning to a system that prioritizes prevention, equity, and universal access. We already pay for healthcare through taxes, premiums, co-insurance, co-deductibles, bills that are partially paid. And we're paying for a system that benefits the few at the expense of the many. And it's time, again, to shift our focus from profits to people. And it's time to stop letting corporations dictate our health and start making the health of our citizens a top priority. It will pay dividends. So we can create a system that works for everyone, a system where no one has to worry about losing their home because they had to go to the hospital, where no one has to forego treatment because they can't afford it. Universal health care is the key to a healthier, fairer, more just society. And we have the power to make that change. We have the moral clarity to see that healthcare is not a commodity. As I said, it's a human right. And we have the courage to fight for a future where every American, regardless of their circumstances, can walk into a doctor's office without fear, without shame, and without financial ruin. So as my dad used to say, you gotta make hay when the sun shines. There's no time like the present. And as luck would have it, the people of this state decided that I'm the best candidate for the next insurance commissioner. And I want to give you my pledge as your next insurance commissioner that I will work toward a future where we can make healthcare for all a reality. Thank you.
We do questions, answers.
Okay, so Ron is going to start with questions from the chat, and then people raise their hand, and we have a microphone going around as well.
The press states that Trump's administration pushed all Medicare recipients into private Medicare Advantage plans. How would this plan pay out with Medicare recipients? Would the Office of the Insurance Commissioner still cover members under plans F and G?
Well, that's an area I'd have to look into in terms of whether or not the state still cover those other plans. I'm not quite as familiar with Medicare. It's not something that the Insurance Commissioner's Office has direct control of. We do take complaints, and we also have the SHIELD program, which is one of those tremendous assets that we have, which helps educate people on their Medicare choices. I will say, the Medicare Advantage plans and this push to privatize Medicare is not going to be good for Americans. And I say that because, again, we have a profit-driven system, and by definition, that means that they just want to make profit off of people who are on Medicare. And the other thing about the Medicare Advantage plans is you go on one, you can't go back to traditional Medicare. This is a real problem. And I intend to make that issue very front and center when I go around the state talking to people about these specific healthcare issues. I also know that as an independently elected insurance commissioner, I will have the ability to directly liaison with our federal delegation about these issues and about what I'm hearing from Washingtonians. I will do whatever I can in my power to make sure that everyone has access to quality health care. And we are already in preparation mode for this new administration coming in. I was just on a call this morning talking about this very issue and about what may be happening to the Affordable Care Act and how we in Washington are going to hopefully rebut that. I can tell you that what I see happening with the new administration coming in is a realignment of the power structure, and I think you're going to see much more collaboration amongst individual states that are like-minded. And I had suggested before, and this is just one path of getting us to universal health care, but an interstate health care compact with the West Coast, with a federated board as a single payer. Because again, that's the most efficient and least expensive and puts the most money into healthcare. So I can't answer your question directly because I don't know the exact answer, other than just know that we're going to be fighting to make sure that you have access to it.
A little closer to home is a question about the Universal Health Care Commission in Washington. Some concern that there's not really a deadline. Can you speed up that process in any way?
Well, I can't do that alone as the insurance commissioner, but the legislature sure could do that. They could put some deadlines in place, and I think that is an excellent idea and one that I've certainly talked about before. But this is where my background as a legislator will come in handy. I have relationships in both chambers on both sides of the aisle, and I have experience on how you get a bill through the legislature and tough bills through the legislature. I mean, I got a pharmacy benefit manager bill passed. I had the bill that required health plans to cover 3D mammograms. I had the bill that required hospitals to provide emergency medical treatment in ectopic pregnancies and miscarriages without retaliating against their providers. I had the bill that got rid of Tim Iman's advisory votes. Happy yeah, it's actually a good one to get that propaganda out there. But so I have that experience, and I also know that as the head of the OIC, I will be able to have agency request legislation. I don't just pick an idea out and go with it. I usually I sit down with the stakeholders, the people who are involved in, who will be impacted by it, and talk to them about what kind of changes need to be made. And I like to hear from all sides, whether they're for it or against it or in the middle or where. Because for me and from my standpoint as a lawyer, I know that hearing things that are wrong with my idea helps make my idea better. Because I'm able to improve on it, I'm able to make tweaks, changes, etc. To propose legislation. And you can always, when you're addressing a concern that doesn't undermine the integrity of what you're trying to do, always do that. Because you end up having less opposition to your bill. And this is something that when I bring a bill to the legislature, it will already have that stakeholdering work done behind it as a foundation before it gets to the legislature. And I also like to bring legislators who are interested in these topics in on the conversation as well.
Another question is, there's been a lot of consolidation of hospitals in Washington and also a lot of purchase by private equity. Any ideas on how to deal with those?
Yeah, it's a big problem. And I would say that, I supported our Keep Our Care Act, which would have put those mergers under a microscope at the Attorney General's office. We were able to get it out of the Senate, but it did not get out of the House. And I think that we need to bring the bill back. I hope they bring the bill back, I should say. I, as head of the OIC, I want to be a resource and a partner to the legislature and provide them with research and information and data and evidence with what they need in order to make informed decisions as they debate these bills that are very substantial, by the way. That was a very substantial bill. That was a Senator Randall bill. And Senator Randall, of course, is now going to be out in Congress. So someone else will probably pick up that mantle. But I do think that that is a really important bill. The other thing, you know, this has to do with insurance companies, but they're exempt from antitrust laws. And most people don't know that. But that makes it really hard to, that's why the regulators are so critically important in being able to get all of the data necessary in order for the actuaries to do their job and market conduct to do their job, et cetera, across the whole agency. And it's interesting, we did pass a bill of mine this last session. It was unanimous out of both chambers that allows the insurance commissioner to obtain proprietary data of insurance companies now when they are reviewing rate increases and things like that. And why that's important is because the bill passed, which exempts that proprietary data from our public records. And that was really the hang up. You know, if it got into the OIC's offices, it would be instantly public and competitors could pick it up and then you could see what could happen. So we shielded that from the public records law. And I think that was appropriate. The media, which is traditionally not a fan of any kind of exemptions to PRA, supported, well, I don't know that they supported it, but they didn't oppose the bill. So I think that is really important to know too. We're going to have more data is what I'm telling you when we look at this now. And I think that that's just going to benefit consumers because in the end, what we need is a more transparent insurance system so consumers know what they're buying.
So are there any questions in the room?
I have a question. My hand's been up for a while.
Question? You're right here.
Can you hear me?
Yes.
Perfect segue into my question, which is why I wanted to go first. In terms of collecting data, will this requirement force insurance companies to start to reveal the amount of insurance matters? Because that is really a black box. And we hear from the Washington State Doctors Association, Medical Association, organizations like PNHP, that many doctors spend inordinate amount of times prior authorizations and claims. So I personally, every time I look at this budget analysis or look at any kind of actuarial study that's going on, I'm always kind of furious, to tell you the truth, because I feel like it's missing this essential component of cost, which is the billing and insurance related matters, that piece of the over. So will your data start to delve that maybe?
Well, I certainly hope so. I mean, and if not, I guess that's going to be another issue tackling. I've heard this before, especially around pre-authorization. I mean, one of the goals that I have as insurance commissioner, we passed a law dealing with prior auth, and I think there might be some more work what I hear that needs to be done, and that will of course have to be legislatively done. And we'll be able to do what we can around existing laws, but in terms of any kind of tweaks to the law, that'll have to be done by the legislature. But I know that that is a real issue, and also that the delay in payment is a serious issue for providers. And I'm trying to wrap my head around why it has to take as long as it seems to take, especially when it should have been approved to begin with. And we've had providers, I've had providers who have said to me that they have already provided the service and they're like 60, 90 days out, they still have not been paid for that service. And you can't run a business like that. So it's something I intend to look at that. And then also the last thing I'd say prior the delay in billing and also the overly complicated, unnecessarily challenging appeals process. Like I said, when my daughter was in the hospital, because I had already represented insurance for insurance companies and had already sued some, I already knew how to push buttons and to get things happen much more quickly. But you shouldn't have to be a lawyer and you shouldn't have to be a legislator to get things, to get your claim timely paid. And that it has real life consequences to patients, by the way, if those claims are not, are initially denied. They know, insurance companies know whether this is a healthcare claim or a property casualty claim or whatever kind of claim. They know that a certain percentage of people do not have the ability or the time or the resources to fight back, to actually finish the appeal process. They know this. And that's part of a for-profit system, right? That's part of the profit is when they deny a claim. So it's something I really want to look at. I mean, in the end, as I've said to the insurance companies, and I'll say this to all of you, you can have a strong consumer advocate in the role of insurance commissioner and a strong, healthy insurance market. The two are not mutually exclusive. And in the end, if insurance companies treat their insurance fairly, which is what the law requires, you know, and according to their contracts, we're not going to have a problem. And the companies that do, and I have been in represented companies that do treat their insurance fairly. So I know that it's done. And those that treat their insurance fairly don't like it when other companies behave badly, because it really gives a bad name to the entire industry. And I know that there are good actors out there. So we just need to make sure that the best practices, you know, are uniform across the insurance industry so that consumers are truly being treated fairly. And again, like I said, that there's transparency and accountability in the process.
Thank you so much for being here. Can you tell us about any bills that the Office of the Insurance Commissioner is planning to introduce or work on in the coming legislative session?
Well, I know that the current administration is putting together a list of potential agency request legislation. I've not had a chance to review that thoroughly yet. So in terms of what we're proposing, that remains to be seen at this point. But there are issues that need to be addressed. And so I can tell you that what I will say is that I'm not going to be shy about agency request legislation. And hopefully the legislature won't be shy about passing that kind of legislation. But when I go into something like that, when I select agency request legislation, I'm going to make sure I have the research and the data to back it up. And so that's why I can't really say right now, but just that I expect there will be some out of the office.
Thank you. You mentioned before the problems with transitioning from Medicare Advantage back to traditional Medicare, and more than 50% of seniors in this country are now in Medicare Advantage. But to try to get back into traditional Medicare when they're fed up with Medicare Advantage, they mostly want to have a supplemental plan or a Medigap plan. But those insurance companies that are basically private don't have to take them, or if they do, they charge them basically based on the pre-existing conditions. However, I think there are 4 or maybe 5 states across the country where this is illegal. So if they transition back, they don't have to pay anything extra. Those Medigap companies have to use their community rating or whatever you call it. So what would it take for Washington State to become one of those 5 and make it 6 that seniors in our state would not have to, you know, have that problem moving backwards?
Yeah, that's a good question. It will take legislation. And again, I intend for the OIC to be a partner and a resource for the legislature. I absolutely support being able to go back. I think that would be a smart move on our part, quite frankly. I think it would increase competition in a way, help competition. So I'm supportive of that, and I would be willing to work with the legislature as they move us toward that 5th or 6th state, whichever. I'd like to know which states do that. If you want to send me that information, I'm happy to look at what their laws say as well, so we can take a look and see how they manage to solve that problem.
Can I just ask you that moment? In addition to what you're talking about, is something that's not so well. Right. Just add an addendum, something that's not so well. It's an individual moves into Medicare Advantage. They have a post open enrollment. They have a 3-month period through March of that year, go back into fee for service. I'm just trying to re-support your comment. But that's available also. What about that again? No, I understand. I'm just saying, but that notion about being in a plan and needing to make a choice after that 3-month window that's there, not well publicized.
There's time for one more?
Of course.
I would just like to again bring up the Advantage Plan topic and ask you, is there any way that you could influence the need to get rid of some of the really fraudulent type advertising that goes on with the Medicare Advantage plans? I get crazy when I see them or hear them, where they really make it sound as if Part C is you would have it on top of A and B, and G, you don't have it. And it's totally deceptive. The average person doesn't really understand what Part A, B, and C really mean. And I thought that Medicare had made, at the federal level, had made some changes to what's allowable in advertising. And but I still see it. And I wonder if there's anything that Washington can do as a state to at least not have that deceptive advertising in our state.
Well, I'd say that what the OIC can do, first of all, is liaison with the federal delegation about the need to address that issue at the national level, because it's a national problem. Secondly, the HCFA program, as I talked about, I was surprised at how many seniors don't know about our HCFA program. And that is the program where I want to make sure that they are have all the resources and tools that they need to do the terrific job they do, but also I want to publicize it more. This office is going to be consumer centered, and that's all consumers. And even though Medicare is, not within the complete jurisdiction of the OIC, if you will, because it's not a state regulated plan, it's a federal program. Medicare is still important to the office because of the need to make sure people have the information, the correct information. And so I know that, we're going to be putting a lot of resources into several things. We're going to be putting resources into technology within the OIC to help them be able to do their job better, training, public outreach. I don't intend to just sit in Olympia. I want to go around the state and talk to people and let people know what resources are at the OIC for them to avail themselves of, especially seniors when it comes to choosing the Medicare plan, and get accurate information. And I think that that's really, really important. But it's also important, like I said, to work with our federal delegation to fix the program and to shore it up, so that we don't end up in a system that is privatized, which is what they would like. And I just got done, my speech was devoted to the failure of a for-profit private healthcare system, right? I mean, it's not working. It's not working for us, we've We've got the most costly, complicated, challenging system in the entire world. And, you know, we've got all these programs on the Senate floor. I called it a Frankenstein model, right? Because we carve out a program for seniors, we carve out a program for the poor, carve out a program for Native Americans. We have one socialistic program called VA for veterans, right? We have private employer insurance if you're lucky enough to have it. And with all that, we still have millions of uninsured people and millions more of uninsured, underinsured people, I mean. And we have thousands who die every year. I don't think anyone can say that's a success. And we can do better, we should do better, and we will do better.
It's so exciting to have you moving into the insurance commissioner's office. And this is just an important time for that to be happening. And we are glad to hear you're verbalizing and supporting single payer as a true outcome. And the work the insurance commissioner has been doing to prepare you. The office has done an affordability report that took several years and pulled information together, and you can, Nico Jensen from your office, the future office, actually talked about some of the details of that to us. Jane and Nico have talked about it in several other agency reports. So we're real excited to see you coming in with the overall picture and building off of the work that the insurance commissioner has done already. So we are thrilled. So thank you for today, and thank you all for your appreciation. We'll take a short break.